Welcome to today's video productions on Mature Healthy Life. In our today's topic on our health issues, we are talking about osteoarthritis. In our previous video, we've talked about arthritis as a general component. Then we picked osteoarthritis specifically as a topic to discuss on it today. So what is osteoarthritis? Osteoarthritis is a degeneration of joint cartilages and the underlying bone that attacks specifically the hip, the knee, and the thumb joints. That is osteoarthritis. Then what are the causes of this osteoarthritis and the risk factors? The cause of this osteoarthritis is when the two underlying bones of the joint come together as a result of the fact that the cartilages and the fluid that cushions this joint are wearing out. They are tearing and wearing. That is why we call osteoarthritis tear and wear disease of the joint. When this cartilage and the fluid wear out and tear, the underlying joint bones that make up the joint, they jam together. We call it jarring. When they jam together, they cause pain and stiffness. That brings about osteoarthritis. Then what are the risk factors? The risk factors of osteoarthritis, one of them is old age. When one grows older, when age inclines, it predisposes one to osteoarthritis because this fluid and the cartilages, they are wearing out because of old age. So it brings about osteoarthritis. That is old age. Another one is sex. Yes, women are more likely predisposed to having osteoarthritis than men. Research has proved it. Another one is obesity. When there is obesity, extra weight makes it heavy for the joint to carry. So it brings about jarring of the bones. That is osteoarthritis too. Another one is joint injury. When there is injury at the joint by accident or trauma, the tendency of infection finding its way into the joint and start tearing, wearing, eating down the cartilages and the fluid that cushions the joint is there. When this happens, then it predisposes this joint to osteoarthritis. That is joint injury or trauma. Another one is repeated stress. When there's a continuous stress of the joint, for instance, through either trying to mend the joint that has had an accident before, continuous stressing of the joint, it also predisposes one to osteoarthritis. Another one is genetics. Genetics in the sense that when there is osteoarthritis in your gene, in your generation, that is in your lineage, your grandmother or whoever had it on your line, you also stand the risk of having osteoarthritis. Another one is bone deformity. When there is a bone deformity in your system, either by osteoporosis or osteomyelitis, then you have the risk of having osteoarthritis in time. Another one is certain metabolic diseases. Certain metabolic diseases can also bring about osteoarthritis. Diseases like inflammatory bowel disease, diabetes, and not the rest of them, they are metabolic diseases. They also can predispose one to osteoarthritis. So my people, in the next video, we are going to bring you the signs and symptoms of osteoarthritis, so that when you see these signs and symptoms, you'll be able to recognize the signs that are coming, that there are for osteoarthritis. So please, if you have watched this video, please share it, hit the like button, comment on the comment section, ask us a question there. Follow us on our Facebook page, Mature Healthy Life, and subscribe to our YouTube channel. Share this video. Please, let the video go viral. Let people that miss it get it. Thank you as you share.